Hi, I'm Genelle Davenport, and I'm doing my scholarly presentation for my research class. Okay, so the topic that I got, the study, is the relationship between simulation in nursing education and medication safety. And that is by Sears, Goldsworthy, and Goodman, 2009. Okay, so significance of the problem. So pretty much simulation post-drug errors. Is there a correlation? New nurses, simulations in class, does that mean that we're going to have less med errors, and does that mean that we're going to be taking better care of our patients and a better level of patient safety? It's very important. If simulation significantly decreases the amount of med errors, let's include that in our education for nurses in our BSN program, because that's going to be very important to our success. We just want to give a sense of common med errors and see like what areas we can go further into and seeing what are the common mistakes we're making and how can we fix them. So the research question and hypothesis. Now our question for the research is, does the use of simulation by second year BSN students in the areas of med surg and maternal child placement environment influence the students' ability to safely administer medications in a clinical setting? So what that means is, with the simulation, us that are in the obstetrics and med surg, are we going to be able to decrease the amount of med errors just because of simulation in the clinical setting? And so the hypothesis is that students experience the simulation lab will increase the students' ability to safely administer medications in the clinical setting, and we'll see less patient errors, an increase in patient safety, and it would be great for us to have that decrease in med errors from simulation. Conceptual model or theoretical framework used, so was not really any. The study just kind of mentions that one of their researchers before, Kimberly Sears, she did research on something similar before. They didn't go way into it, and they said that, our survey is kind of based on her past work. And they also said that they used some assessment data from pediatric errors that have been reported, and that they use some literature to kind of influence their surveys and their post-tests. We have some independent, dependent, and research variables. So our independent variables, we have the use of simulation and with the second year BSN students, and our dependent, we have the amount of medication errors recorded or found. So we have some other research variables that the researchers mentioned in the study, and pretty much what they said is that the student's age could have influenced the results, the past experience with administering medication could have impacted the results, or maybe they're repeating this class, that could impact the results. Maybe the student studied before taking the simulation or studied before going to clinical about medication errors, so that could really influence how prepared and the results of the study. Maybe the student's GPA, maybe they're better prepared already and they make less med errors, so that would impact our results. And okay, so the next one is our interventions and intervention procedures used. So the intervention is simulation. The way that they describe it is that students would come in their uniform, and they would be split into groups of 5. And mind you, like, we already split this up. 30 went to the control group and they just did regular clinical, and now we have 24 left that are in the simulation group. So that simulation group of 24 was split into 5 groups of 5, probably 1 group of 4. And what they're told to do is they're going to work on this client, given the report information, and they were given 1 hour to kind of like learn about their patient, get a report on that patient, and be prepared to take care of them. And then they'd be able to do assessment, intervention, medication administration that they thought they needed to do or were instructed to do, and then they would debrief for 2 hours with an instructor and redo the situation. They would say, this is what I liked about it, this is what I didn't like about it, these are the mistakes we made, these are the good things we did, and this is how we can do it better. And these simulations were based on people in med surg and obstetrics, and they kind of just helped say okay, this is a common med error, this is a common med error, this is how we can work on it, let's show these students, see how they respond to this, and see how we can decrease it. So then we have the design, setting, sample, and some inclusion-exclusion criteria. The design, it was a randomized control group, post-test only, because we just randomly split them into groups, and we did not do a pre-test to see what they knew before. We just were seeing, okay, what errors are they making. Setting, Ontario, Canada, it's a nursing school. And the sample, we started out with 54 volunteers out of the BSN nursing students who are in their second year from that nursing school in Ontario, Canada. And then we split them into 24 for the treatment group or the simulation group, and then the 30 went to the control group or the clinical group where they just went, 8 hours regular clinical. And then inclusion criteria, you need to be a second year BSN student going to this study of choice, and you need to be doing, going into the college of choice, and you need to be in your med-surg and obstetrics setting or rotation. The exclusion criteria would be any student not currently enrolled in their second year of BSN nursing in this study's college. Okay, so ethical components, it did get approved by something similar to IRB, but it wasn't exactly IRB. That's pretty much all they said. The data collection procedure, so they used an instrument adapted from one of the researchers. They kind of had a past study, like I said before, that influenced their survey, and they used that. They also did it by clinical instructors would pretty much observe anything that they witnessed, any medication errors they witnessed and observed, and write it down on a piece of paper, report. And then no demographic data was collected. They want to make sure these students are well protected and there was no way to identify them. And those reports were then stored in a filing cabinet and then taken out to be put into the SPSS version 13 software for analysis. So the data that they kind of collected, it would have been the unit that happened and the clinical instructor it happened under, and then we would see which 5 rights were broken, and then we would see what was the impact. How bad was it? How bad was the med error? And we would see which factors contributed to the incident. Was it lack of knowledge? Was it something that we can work on? Was it communication? Okay. And then the results. So pretty much what we found was that the control group made 24 errors, the treatment group made 7 errors, and the total was 31. So they kind of expected that there'd be 31 errors, but they thought it would be half and half between the treatment and the control group. But what they found is that more students made errors in med-surg, and that more students made errors in the control group. So the implications, it just kind of shows us that this is very important. This is going to show us where we can study into, and that simulation does contribute to the amount of med errors. And then our limitations, there's only one nursing school, and that nursing school had the 2 groups, so it's not a good generalization. And we also said the 2 hospitals, one might have been easier than the other, losing volunteers because they thought oh, I don't know what a simulation is, or oh, I'm not very good at it, I'm not going to volunteer to be in part of the simulation because I'm just going to do bad. And maybe the instructors or the clinical instructors could have been biased in their grading. Now, the conclusion, we know that this is going to provide more knowledge in this area for nursing, and we're going to learn that, maybe if we include some simulation, we can really decrease our med errors, include it in our education. And then it's just going to make sure we have better patient safety, and it's going to recommend any areas that we can go into. Maybe because we saw that med-surg has more errors, we're going to study how can we prevent those medication errors in med-surg. And we can really learn a lot from this, and it can impact our patient safety. Okay, so then that's my presentation, and this is my resources. I'm done. All right, bye.